Hi, I am Dr. Felice Gersh, your integrative OBGYN physician. There was a study that was published just recently. It came out of the United Kingdom that looked retrospectively at a few thousand women who went into menopause early. So, what's the definition of early, normal, late? Well, this is somewhat arbitrary, but early menopause is typically called 40 up to 45. 45 to 55 is considered normal, and over 55 is considered late. And under 40 is considered premature. Well, in this study, they used the word early, but what they were actually referring to was before the age of 40. So just, I wanted to make that clear because there's a little difference in using the words for definition. So we're talking about really early menopause before the age of 40. And what did they find among these women? They had significantly higher rates of cognitive decline and depression compared to women who had a normal menopause around age 50 or so. And it was really quite significant. They looked at all types of different cognitive issues, different types of early, late memory recall, fluidity with their vocabulary, and so on. And they found that they were diminished in all the different ranges of cognitive function that they looked at. And also, depression was significantly higher. And these go together. A lot of people don't realize the brain is one whole. And when it's not working right, usually due to some degree of inflammation, malfunction, energy deficiency, or insufficiency, you have alterations in mood for the negative, and you also have alterations in cognition for the negative. And it actually went worse as far as I was concerned, because in the study, they looked at women who had been given hormone replacement therapy. And what did they come up with? They did worse. That women who were on hormone therapy for at least 11 years after they went into this early type of menopause, they had worse cognitive and emotional states than women who didn't go on hormones. So it made me want to talk to you about this. Number one, to explain it so that you can try to understand how could hormones that are so good for the brain. I'm going to tell you at least a lot of the wonderful things that estradiol and progesterone, the hormones made by the ovaries, do for the brain. Then how could it be that, well, it would certainly be obvious that if you lost those hormones, your brain would suffer. But what if you give hormones? Then why would it suffer even worse? How could this be? So that's what I want to talk to you about. Number one, let's just start with what these vital life hormones, estradiol is the estrogen that's made by the ovaries during the reproductive years, and progesterone, real progesterone, not fake stuff that we call progestins. So what do those do for the brain to make the brain happy and healthy? Well, let's start with estradiol. And this is not going to be comprehensive, but it's going to cover a few key points. Number one, estradiol is wonderful for neuronal health. The neurons that are in our brains love estradiol, just love it. Estradiol is neuroprotective. Now, I want everyone to remember that. That's really important. Estradiol is neuroprotective. We didn't get estradiol in our bodies to harm our brains or give us bad mood and depression. Not at all. Estradiol is anxiolytic. It reduces anxiety. And there are serotonin neurons in the brain that rely on estradiol for their proper functioning. Serotonin, the neurotransmitter that makes us feel happy and good in our bodies, that's the neurotransmitter that people try to increase when they take pharmaceuticals like Prozac and Zoloft and Lexapro, the SSRIs, selective serotonin reuptake inhibitors, to try to keep more serotonin in the synapse, the spaces between the neurons, so that it will act longer and make the brain happier. That's why they're antidepressants. Well, we're not going to go into them, but let's talk about estradiol and serotonin. You do not have proper functioning of those neurons that make serotonin, nor does the receptor work properly when you don't have enough estradiol. And what about oxytocin, often called the love and bonding? You can consider it a peptide or a hormone. They're very similar. Well, estradiol is essential for the proper functioning of oxytocin that makes us also feel good. It also reduces appetite and feel bonded and just loving to people. So we need that. That makes us happy people too. And what about other neurotransmitters like dopamine? Estradiol is really important. Acetylcholine that helps us to have memories. Okay, to form memories, you need acetylcholine. Well, estradiol modulates the functionality of acetylcholine. Well, what about synapses? I mentioned synapses. You want to have serotonin stick around longer if you want to have more effect from it. That's what the drugs do or try to do. Well, estradiol is very great for increasing synapses. And we call that neuroplasticity, that the nerves can regenerate, create more and new connections, synapses. Estradiol is critically important for that. And I mentioned the neurons, neurogenesis. Estradiol helps maintain the health and function and even repair and replacement of neurons that are, of course, essential for brain functioning. And what about the vascular system? It's very common, unfortunately, that humans, especially females, but males too, get what is called vascular dementia. Well, that's related to not having proper nutrients and oxygen go to the brain because of vascular disease. Estradiol is critical for vascular health. It helps create that incredible gas called nitric oxide that maintains vascular dilation so you don't have constricted arteries and vascular health, and you don't get leaky arteries either, and you don't get a leaky blood-brain barrier, which isn't much of a barrier if you don't have enough estradiol. The purpose of the so-called blood-brain barrier is to keep toxins, toxicants out of the brain itself, because we don't want our brain filled with chemicals and heavy metals and viruses. Well, if you don't have enough estradiol, you don't have a really good functioning barrier to keep them from getting into the brain and causing havoc, like mood problems and dementia. And what about the immune system? We have an implanted, specialized immune system in the brain, and those cells are microglia and their cousins, the astrocytes. Well, the microglia are specialized macrophages. They're specialized immune cells. I call them the gobblers. They have the ability to put out like enzymes that dissolve dead tissue, pathogens, and then they can phagocytosis occurs, and they gobble up dead cells. They gobble up pathogens like viruses, bacteria that you get into the brain. Well, guess what? Estradiol is the modulator of the immune system. Without adequate estradiol, those microglia act like weapons of mass destruction without control. They put out their enzymes and not only dissolve bad stuff, dissolve like damaged tissue, dead tissue, pathogens, they dissolve our healthy neurons too. So they create damage. And then in response to this damage, the brain tries to control it and creates the amyloid beta that actually is measured and found to be high in most people who have Alzheimer's disease. Well, it turns out that all the drugs that they kept trying to create to get rid of that response didn't get rid of dementia and didn't prevent it, because it turns out that those proteinaceous materials like gunk in the brain, the amyloid beta was a response to the inflammatory damage caused by the microglia, which are out of control and create havoc and damage when you don't have enough estradiol to manage the situation and keep them under control so that they don't create inflammation and become activated for no good reason. So estradiol is neuroprotective. It's wonderful for the brain. It reduces depression, anxiety. It helps create memories. It just does all these wonderful things in the brain. So if you lose it, the clock starts ticking in terms of decline of all of those wonderful features that estradiol maintains for the brain. And what about progesterone? Progesterone is also neuroprotective. Progesterone helps to maintain and create the insulation of neurons called the myelin sheath. If you don't have the myelin sheath, you cannot have proper functioning of your neurons. It needs that special insulation. Okay. Now, what medical condition is associated with loss of that myelin sheath, that protective insulation of nerves for proper nerve function? Well, you've probably heard of it. It's called multiple sclerosis. And multiple sclerosis is, of course, associated with reduced function of motor and sensory neurons. So you don't feel proper things and you don't move things properly in the body. But also, it's also associated with cognitive and mood changes because you need that insulation on the neurons for the neurons to function properly. It's actually been shown in studies that progesterone can help the brain get healthier and prevent damage if you have TBI, traumatic brain injury. And so progesterone helps prevent uncontrolled inflammation in the brain as well. It's very anti-inflammatory. And in fact, when you have brain trauma, the brain will produce its own supply as best it can of both estradiol and progesterone to help control the microglia, control the astrocytes, help with repair, and help prevent out of control, horrible inflammation that leads to further injury and damage of the brain. So progesterone is wonderful for the brain. It also increases GABA. I mentioned the neurotransmitters associated with estradiol, and estradiol also has a relationship to GABA, and it's complex. But if we talk about just progesterone and GABA, progesterone, especially through its metabolite, it comes from progesterone and can be made from progesterone in the brain. It's called allopregnanolone. It activates GABA receptors. GABA is the inhibitory neurotransmitter that helps to create sedation and calmness. The opposite is glutamate, and estradiol helps to control and activate glutamate, which helps to be active and focused. But too much is a problem, then you could have seizures. And too much GABA is a problem, then you could be too sedated. But when you have the right amount of hormones, it's all working perfectly. You have focus when you need it. You have sleep and calm and sedation when you need it. That's why you need this beautiful balance of the hormones in the beautiful levels, physiologic levels, and cycles and rhythms of these wonderful hormones. And as I mentioned, they can also be made in the brain. So they're also called neurosteroids. They're steroid hormones, and neuro, meaning, of course, neurological, the brain actually will make them. But the brain can't make enough. You need the hormones from the ovaries as well to supply the brain with adequate estradiol and progesterone. So these are really wonderful hormones for the brain. So, of course, I knew, and anyone who's in this field knew before this study came out, that if you lost these hormones early, the earlier you lose them, the worse off your brain will be. I mean, that's logical, but it's always good to have a study that shows what you already obviously knew, because these hormones, and by the way, we know lots and lots about all the harm that develops in women at earlier stages if they lose their vital life hormones because they go into an earlier menopause. They have higher rates of not just dementia and mood disorder, but also cardiovascular disease, osteoporosis, osteoarthritis. So, bladder problems, incontinence, everything starts when you lose your hormones. It's not your chronological age, it's your loss of these hormones that really is going to determine your stage of aging. But then what about that part of the study that said that women who went on hormone replacement therapy, actually fared worse than the women who took nothing? This is what drives me crazy because they always talk about hormones like it's one thing. Well, it would be like talking about food like it's all one thing. If you did a study with ultra processed food, like the worst of the worst, and then you said, oh no, ultra processed food is really bad. It gives you diabetes and it gives you obesity and inflammation and heart disease. So you should not eat food. Uh-oh, what are you talking about? Another analogy I always use. You do a study with strawberry flavored jelly beans, and then you say at the end, when it turns out that the strawberry flavored jelly beans increase the incidence of diabetes, obesity, and cavities, your conclusion isn't, well, don't eat strawberry flavored jelly beans. No, your conclusion is don't eat organic farm fresh strawberries. That doesn't make any sense, but that's what they do when they say this stuff. They say, well, when you take hormones, you're worse off. What hormones? It's like, what are you eating? Are you eating strawberries, organic from the farm, or strawberry flavored jelly beans? Are you eating whole, fresh, organic food, fruits and vegetables, and fresh beans and lentils, ancient grains? Or are you eating ultra processed food filled with chemicals and devoid of nutrients? And that's what they do. That's why it drives me crazy. So when they say, well, if the women took hormones, they did worse. What hormones? Well, I'm sure that it's whatever the people were taking was similar to what everybody else was taking at the time, which was conjugated equine estrogens and a progestin, medroxyprogesterone acetate, because that's what was being used. Well, it turns out that that's like the equivalent of strawberry flavored jelly beans or ultra processed food. It isn't what your ovaries made ever. Those hormones, if you want to call them that, I call them what they are, endocrine disruptors. The hormone for the estrogen, conjugated equine estrogens, would never exist in a human female body ever at any time in the history of humanity. Never. It doesn't belong in a human. The horse is trying to get rid of it. That's why it went through the liver, conjugated it. That's why they call it conjugated. That's a metabolic process that transforms this estrogen combo from being fat to water soluble so it can go out of the body in the urine. The horse is getting rid of it. And they're equaline types of estrogens. They're specifically horse estrogens. They're not found in human females. And like I said, these are old, yucky estrogens, and the horse is trying to get rid of them. And then they take the urine, and then they dry it, make it into a tablet, and then they give it to adult females who are aging. And it turns out that when you take that kind of estrogen, it increases your risk of blood clots, spontaneous blood clots, 400%. This has been proven. Well, that's not good for vascular health. If you get blood clots, those little blood clots can create like strokes, but they don't have to be like obvious stroke. They could be tiny, tiny little tiny strokes that can actually impede the vascular function and oxygenation and nutrients going to the brain. And over time, that can cause dementia. If you have vascular dysfunction, you get vascular dementia. So that's a problem. Also, when you swallow the conjugated equine estrogens, the brand name that they used in the study was called Premarin. When you swallow it, it goes through the digestive tract to the liver, where it is largely converted to estrone. Well, I said estradiol, E2, is the estrogen made by the ovaries, not E1, estrone. Now, estrone isn't evil, but you shouldn't have tons of it. It should be in balance with estradiol, and you should have the amount that the body needs. So now you're getting the amount the body doesn't need, and you're getting predominantly estrone. Well, it turns out that estrone is more pro-inflammatory. And that is a bad thing because the last thing we want is inflammation, uncontrolled inflammation in the brain. Oh, and I forgot one thing I just remembered about what estradiol does. I can't leave this off. So, estradiol also promotes growth factors like brain derived neurotrophic factor and nerve growth factor that help neurons to grow, repair, and replenish. We need those growth factors. We just don't want out of control growth. Well, it turns out that estrone also creates growth factors, but in a more uncontrolled way if you don't have estradiol, E2. So the brain does not love estrone, it loves estradiol. So when you have a body filled with estrone, you go into a more pro-inflammatory state with more uncontrolled proliferation. That is not what we want. And what about the progestin, the fake progesterone that is, used back in the day? Still used today, though, still out there. And that is medroxyprogesterone acetate. This is not real progesterone. It never exists in a human body naturally, ever. And it is not the same as progesterone, even though it has the word progesterone in it. It is not progesterone. It is totally different and it has different effects in the body. And it is not great for vascular health, and it is not anti-inflammatory and neuroprotective the way real progesterone is. So now you're putting two chemicals, hormones that never exist in the human body, that have some negative effects, and then you expect to have a great outcome. Well, you get what you put in. You get the outcome you expect, which is it's not neuroprotective. In fact, it even can be harmful. And that's a huge problem because we know that during the reproductive years, we know so much about estradiol. We know so much about progesterone and all the wonderful things it does for the brain, that they're both neuroprotective. So how could it be that if you go through menopause at age 40 and then you give these wonderful hormones, you will have a long-term bad outcome? But if these wonderful hormones are continued to be made by your ovaries and then you lose them a decade later, then, the clock starts then. That why is it that we can't give hormones that mimic what the body would have been making during that decade had the ovaries not essentially, pooped out on us and not made the hormones anymore? That's what we need to be working on. We need to give hormones that are essentially as close as we can, mirroring the levels and, of course, the actual hormones that a woman would make during her reproductive years that deliver the goods, that create this wonderful state of neuroprotection. And you're not going to get it if you do a number of things that are being done today widely. Number one, you give hormones that are never, ever, ever naturally in the human body that have totally different effects, often pro-inflammatory and not neuroprotective. So we don't want to give fake human hormones. We only want to give bioidentical hormones that are identical, molecular clones to the hormones that ovaries make, not some fake thing. Think of it similar to fake food, ultra-processed food. I call it faux food. We don't want faux hormones in our body. We want bioidentical, human-identical hormones because they bind to the receptors and they create the proper effects. Okay, you cannot substitute something for them and expect the same outcome because we know the outcome when you have bioidentical hormones is wonderful. That's why women who keep their hormones functioning longer, have these hormones in their bodies longer, they're better. Okay? Now, what else do we need to think about? Well, how about dose? This is another huge problem. Everything is dose related. If you do a study and you give minute doses, are you going to get a great outcome? Think about vegetables. Think about exercise. If, say, we'll just start with exercise. Someone says, I believe in exercise. It's good for you. And then someone else says, no, we did a study on exercise and it wasn't beneficial at all. It's like, well, what'd you do in the study? Well, the study subjects exercised mildly for 5 minutes a month. No benefit. Exercise isn't useful at all. Well, I would say that study is a piece of trash, wouldn't you? Like, what does that prove about anything? You gave someone a minimal amount of exercise to do, 5 minutes a month. That's it. Well, how is that similar to exercising moderately 5 days a week for 30 minutes plus adding in 3 to 4 days a week of resistance training? Well, I don't think they're comparables. Well, if you do a study and the dose of estradiol you give creates levels in the body that are the same as the levels you get when you don't take the hormones, it's so low, it's in the menopausal range. And then you say, see, it's not working. What does that prove? It proves you didn't give enough. You didn't exercise enough. You didn't eat enough vegetables. We can go on and on. If you don't give the right dose, you're certainly not going to get the right outcome. And what about progesterone? Well, what if you give it orally? Well, 80 to 90% of it is converted to allopregnanolone, and only a little bit gets into the blood. So, well, they're not going to get very much progesterone, but I told you allopregnanolone was good. Well, too much of a good thing is a bad thing. So we don't want to overdose on it because then it is overly sedating to the brain. And what about receptors going up and down, turning them on and off, changing gene expression? Well, for all those good things to happen, you need to have cycling of progesterone. You can't just have it a little bit every single night. So we're doing it wrong, guys, but we definitely need more studies. But we need studies where we give hormones that are similar to the regimen that our bodies give us and at the levels that our bodies need so that you get the desired effect. We cannot accept studies that end up saying loud and clear, but wrongly, that giving hormones will worsen your outcome over the long haul for cognition and mood. This breaks my heart that people reading this study, they could be anyone, they could be professionals in the medical world, they could be the regular public, but the takeaway is early menopause is really bad, but so is going on hormones really bad. Early menopause is bad. Loss of these vital life hormones at an early age leads to more damage across every body system. And hormones are good. They're not bad. You got to give the right hormones and you got to give the right doses and you got to give it in the right rhythms. And then we should get the right outcome. Of course, we need more studies. But what are we to do? Well, we're waiting for the studies. Let every woman increase their risk of cognitive decline, mood problems, and then we won't even get into in this particular segment all the other things that go awry when you don't have those vital life hormones. Yes, we need more studies, but we have science to help us to make decisions now because we women who need hormones can't wait and wait because the studies are not on their way. And so sad to say that the studies that have been done were all tainted by the Women's Health Initiative, where the mantra was the smallest dose. The smallest dose is ridiculous. Just like the smallest dose of exercise is ridiculous, the smallest dose of vegetables is ridiculous, the smallest dose of sleep is ridiculous. What we want is optimal, not smallest. We want optimal doses. And that's not what's being studied. So, yes, I want to do studies, but yes, I want to help my patients. I have to balance the two. I cannot prove everything I say with a clinical study, but I have so much science behind me. I have to rely on that because we have to make decisions, and doing nothing is a decision. So think about all the things I've just talked to you about so that you can help formulate what you feel is right for you, your patients, your friends, your loved ones. But keep in mind, bioidentical estradiol and progesterone are neuroprotective.